My name is Angie Goodwin. 22 people die every day waiting for an organ transplant in the United States. There are currently 119,000 men, women, and children on the national transplant waiting list according to the United States Department of Health and Human Services. One of those people is my friend Rob Carrington. Last year, Rob developed a cough and he didn't go to the doctor because he didn't feel bad or feel sick. Little did he know that he had pneumonia and it was causing irreparable damage to his lungs. Currently, Rob is unable to work and is on the transplant list waiting for a new set of lungs. Today, I will try to help ease your fear in being an organ donor and provide the facts on organ donation and encourage you to put your name on the donor list. By doing this, hopefully, people like my friend Rob will get another chance at life. Per the Journal of Communication in Healthcare, most surveys indicate that people have a positive attitude towards organ donation. However, there's a huge discrepancy between organ donation attitude and the number of actual organ donors. Studies show that 95% of the population approve of organ donation, yet less than half of them are actually registered donors. Some of the leading causes of not being on the donor list are mistrust of medical professionals, the lack of proper knowledge of organ donation, and the religious belief of bodily integrity. A common fear that people have of being an organ donor is that once the hospital finds out that you're a donor, they won't work quite as hard to save your life. When you've been admitted into the hospital, their one and only priority is to save your life. Organ donation does not even become a possibility until every life-saving measure has failed. Another fear people have is that someone can take their organs and sell them. Federal law prohibits the buying and selling of organs in the United States. Violators can be punished with prison time and fines. Some people are afraid that their religion is against organ donation. However, most major religions in the United States support organ donation and consider it the final act of love and generosity towards others. Some people are afraid that organ donation will keep them from being able to have an open casket funeral. Donor bodies are treated with the utmost care and respect, and even with donating tissue, there is still no visible damage to the body, so you're still able to have an open casket funeral. In the Journal of Legal Medicine reports that the last increase in organ donation increasing was between the 2003 and 2005, when the U.S. Health Resource and Service Administration and the Institute for Healthcare Improvement teamed up and made a national effort to inform the public about organ donation and practices. Nationally, only about 40% of all licensed drivers are on the state registry for organ donation. The American Transplant Foundation reports that one donor can save up to 8 lives with organ donation and help more than 100 more through tissue donation. Since 1988, over 650,000 transplants have been performed in the United States. Recipients are chosen based on their compatibility, their location, and their medical need. Every organ has a different life expectancy after being harvested, so travel time allowed is limited. A heart can only last for 4 hours after it's been harvested. A new name is added to the national transplant list every 10 minutes. There are over 2,000 children under the age of 18 on the waiting list. Currently, there are 75,000 people waiting for a kidney transplant, with only 17,000 of these surgeries expected to be performed this year. With an increase in the number of people with renal failure and chronic kidney disease increasing exponentially, the donors just can't keep up. The average wait time for a kidney is 5 years, and over 4,000 people die every year on this waiting list, with many more names being taken off the list because their health has deteriorated so much that they would never survive the surgery. And the longer that a patient's on kidney dialysis, the higher the risk is of complication and death after transplant. The need for organ donors far outreaches the number of living and deceased donors. Only 3 out of every 1,000 people are viable for organ donation. They have to die in such a way where their organs can be saved. These are people that go into the hospital with an accident or illness, such as head trauma, brain aneurysm, or stroke, where they can immediately be put on life support, and so oxygen and blood are constantly flowing to their organs until brain death has been determined. There were over 30,000 organ transplants in 2016, but with over 119,000 people on the waiting list, there are far too many people that desperately need our help. The Rhode Island Medical Journal stated that within the last 30 years, the number of organs donated has not kept pace with the number of organs needed. And with the increase in life expectancy, obesity, diabetes, and alcohol-related liver failure, there's just not enough organs. Currently, there are limited education programs for the population on organ donation. People lack the basic knowledge and understanding, such as the need, the time, and the effort and the risk organ donation entails. Many people, such as my friend Rob, cling to life with the hope that the organ they need will become available. It gives the person donating a last chance to make a huge impact on people's lives, even after their own death. The women, men, and children on this waiting list need our help. Thank you.